All right, guys, so it's been the first week of my new diet. I told my doctor this year is going to be the year that I go from, that 200 to that 100 pounds. I'm going to do it, but I got to be honest. This week I really struggled. I got some flamin' hot Cheetos and I broke my diet. I'm really struggling. Tomorrow will be the day that I start again. The first article really stressed the importance of patient engagement. Basically, this is the ability of patients after seeing their doctor, basically adhering to the behaviors and the changes that need to be made in their life in order to improve either, the illness that they're dealing with, maybe an addiction, something along those lines. In order to increase patient engagement, they were able to basically find the subset of articles that gave way to major IT platforms that could highly increase patient engagement. Of these IT platforms, there were a couple that were supposed to be kind of the most informative that they used throughout the whole article. These include internet-based interventions, mobile-based interventions, social media, video game technology, and telemonitoring.
The introduction of IT platforms into the medical sphere seems to have a significant positive impact on real-world health issues. 87% of studies research show that internet-based platforms can create a significant impact on health outcomes, with that percentage climbing up to 91% in the case of mobile platforms. Interestingly, social media seems to have a positive impact on medical outcomes due to its ability to spread knowledge and create psychological support. This can be seen both with Twitter's usage with cancer patients and with Facebook's usage with asthma patients. Furthermore, these studies seem to show a correlation between IT platforms and an increase in patient engagement. This can be seen through the use of text messaging, social media, and even with video games. While these results are not conclusive, as several studies research show no significant impact on patient outcome, the overwhelming majority seem to show a strong positive correlation between IT platforms and patient outcome.
IT-based health intervention has shown a great impact on patients' health outcome in the US by changing their behavior. Social media platforms like Facebook and Twitter allow individuals to connect with each other from all over the world to form a community, sharing their stories, advice, and motivation. The more the patient participates in the IT platform to create a repetitive behavior, the more likely they were to improve their health outcome, changing the way they normally think and challenging their brain to do something it hasn't done before. However, there were limitations in this article, like unequal access to the IT platform, poor interface design, and privacy issue.
Regarding the second article on the development of the wearable disposable respiration monitor, as a public health major, I believe this is a great development because it focuses on a preventive approach in treating asthma by catching the negative symptoms leading up to attacks and allowing the patient time to find an inhaler or medical care. It's very convenient to be able to access that data easily on a smartphone app too. I also think that designing the device to be small, lightweight, not noticeable, and not bulky was a great decision because it is a device that would need to be consistently worn to collect the data needed and allow for proper monitoring.
I also did the article on the elastic-like band to measure rate and volume of respiration. To be honest, I didn't know how flexible it was to take a toy like Shrinky Dinks and make a product that produces like respiratory information or information that could be very informative or helpful to doctors. To be honest, we need more people like this in healthcare. People like UCI professor Michelle Kine, who took her creativity and was thinking outside of the box and took something like a toy and then put like sensors and things like that to put onto like your chest to measure the rate and volume of respiration. I didn't even know that was possible, but that's very inspiring and very cool. And hopefully in the future we can all think of something like that to save lives of other people.